Yeah, it's great to meet you. Before the meeting started, I had a chance to meet with some of you individually. And, you know, I think when we're patients or we're caregivers, we want to be treated as individuals. We live as individuals, we live as a community. And I think that's really a big part of what public health is. It's treating people as individuals, as listening and understanding their personal situation. I just really thank you for being so open and coming before us, before each other, and telling your own stories. And I feel like I should be telling my own story too. Well, it's not fair that you guys are telling yours and I'm not telling mine, but when the program does move to the Department of Health, and it's going to be January the 1st, this is a new thing for the Department of Health. Okay? But one of the things I can promise you is we're going to try and focus on patients. We're going to try and focus on individuals and their individual needs. And I think that's one of the marks of public health. And you know, initially when you start applying, starting January 1st to the Department of Health rather than to the Department of Public Safety, I'm hoping you're going to be able to feel a sense of that. A sense of ease, a sense that this is a public health issue, that we're listening to what your needs are. Now, initially some of the forms and the applications and the processes are going to look just the same. But over time, they're going to start changing. And what we're going to try and do is inform you of how those changes are going to take place. And we're going to be setting up a website. We're going to be trying to inform you through a series of different ways. So I'm telling you right now, things starting January the 1st are going to start changing. It's not going to be perfect from the get-go because we've really got to learn how to do this. But we're going to be listening. And today is really a really good start with that. Another thing I wanted to say is on this task force that Representative Belatti has talked about, there are patients and there are caregivers that are on the task force. They're not here with us today, but I think you would be very happy and very proud of your fellow patients and caregivers that really represent you very well from their perspective. So I think that's really an important point. It's not just the people you're seeing here, there's other people that are part of the process. So I'm going to come back a little later with a couple specific questions, but I just want to say how much I appreciate meeting you and look forward to working with you in the coming years.